Hello dear students. Today we are going to learn about pharmacodynamics. So pharmacodynamics is a major part of pharmacology which will give details about the mechanism of action, drug actions, etc. Under this chapter, first topic is introduction and type of drug action. Outcome of today's lecture: the student will be able to explain the basic of drug action. Number two, the student will be able to analyze the various types of drug action. And third one, the students will be able to describe the various types of drug action. Pharmacodynamics is concerned with actions of drug, interaction of the drug, and mode or mechanism of drug action. So it gives insight how the body will get affected by the drug. Drug action. Drug action means drug combination with enzyme, cell membrane or other functional part of a cell is called a drug action. That means interaction between drug and some part of the tissue cell. It may be enzyme, it may be cell membrane, a functional component has been occurred. This is called drug action. If there is no combination or no interaction with any part of the cell, we will not say there is a drug action. Once there is a drug action, means the drug has combined to the cell membrane, etc., any part of the cell. After that, it will cause biochemical and physiological changes. This is called as drug effect. So the drug may have drug action as well as drug effect. Drug action means combination with some part of the cell, and effect means there should be some change in biochemical and physiological functioning of the cell. So drug action do not create new functions, just they will modify the natural inherent functions of the tissue. Either they will increase the functioning of the tissue or they will decrease the functioning of the particular tissue or cell. For example, if you take a drug known as caffeine, what it will do, it will increase the activity of CNS. That means it is modifying the normal functioning of CNS. Some drugs are there which will decrease the activity. That means they are modifying the natural property, but they will not create something new in that tissue functioning. So next type of drug actions. So drugs may produce their effect by stimulation, depression, irritation, replacement, physical action, chemical reaction, antimicrobial actions, and last, modification of immune system. So we'll see one by one. First we'll start with stimulation. Stimulation means indicates an increase in the activity of specialized cells. So in our body we have two types of cells. Some are specialized cells like kidney cells, GI tract cells, etc. Some are non-specialized cells like epithelial cells, connective tissue cells. They comes under non-specialized cells. The stimulation indicates an increase in the activity of specialized cells like caffeine stimulates cerebral cortex cells, cysteine stimulates spinal cord cells, that is neurons. So usually stimulation is followed by depression. Next is depression. Depression indicates an decrease in the activity of specialized cells. For example, barbiturate depresses the central nervous system, alcohol depresses the central nervous system. There will be a decrease in the activity of these specialized cells. Next is irritation. So irritation means there will be injurious effect of drug on growth, nutrition, and morphology of non-specialized cells. As I told you earlier, non-specialized cells are those cells which will not have any specific functioning. Like for example, epithelial cells or non-specialized cells, non-connective tissue cells or non-specialized cells, etc. So they are capable of producing inflammation. So we can see here inflammation. So this is strong irritation and this one is mild irritation. So mild irritation that produces inflammation and there will be death or severe damage to this tissue if there is a strong irritation. So mild irritation may stimulate associated functions. Examples: bitter increases salivary and gastric secretions. If you eat something bitter, it will increase the salivary secretions, as we seen with bitter tablets, etc. As well as counter irritants increases blood flow to the tissue, and irritation purgatives like senna, etc. They all function by the mechanism of irritation, that is they will change or damage the morphology and the functioning, etc. of our non-specialized cells. Strong irritations results in inflammation, necrosis and morphological damage. This, this may result in diminished or loss of functions. Examples are cytotoxic effect in anti-cancer drugs, necrosis, the death of most or all of the cells in an organ or tissue due to disease, injury or failure of the blood supply. So we can say here strong and irritations. Next is replacement. So this refers to the use of natural metabolites, hormones or other congeners in deficiency state. For example, a person is suffering from diabetes mellitus, that means the person has a deficiency of insulin. The patient's body will not able to produce the insulin. For that reason, we will take the insulin from other source, like from animal source or from microorganisms, and we will replace it in our body. Like iron in anemia, so we take iron from outside of the body and it gets replaced in our body to decrease the deficiency. Next is physical action. Some drugs act in pure mechanical way because of their physical properties. So like Cavolin administered in dysentery for its absorption property, saline purgatives for its osmotic pressure. So they act mainly because of their physical actions. Cavolin, like, it has absorption property, it will absorb the irritants or toxins from the GI tract and stops the adverse effects, or that is the reaction of toxins. The saline purgatives, what they will do, they will absorb the water from the surrounding area and stimulates the peristaltic activity and shows a purgation. Next, chemical reactions. Some drugs act because of their chemical properties or by chemical combination with substances present in the body. For best example, we use antacids to neutralize the HCl present in your stomach by their chemical interactions. So, in chemical reaction, there will be chemical reactions with external drug and internal some body substances like HCl from stomach, and that is alkali from outside source. So the alkali work by neutralizing the acid. Next, we know that there are a lot of microorganisms, viruses, etc., which will enter in our body and causes inflammation or disease. So now we want to kill that bacteria which are producing the disease or which are damaging our body without damaging our body. So this is can be done by the help of antimicrobial agents. So drugs are used for prevention, arrest and eradication of infections. So these act especially on the positive microorganisms without damaging the host cells. The first preference will be that they should not damage the host cells. Examples are penicillins, tetracyclines, etc. Again, this antimicrobial agent has two types of action: bactericidal, which kills the bacteria, and bacteriostatics, which inhibits the growth and multiplication of bacteria. And the last is modification of immune system. So there are a lot of vaccines, anti-seizures and certain other agents act by altering, that is enhancing or depressing the immune status. What happens in this system? Will introduce a non-toxic, neutralize either maybe bacteria or virus, etc., in our body. Because of presence of this reacting bacteria, neutralize bacteria, what happens? Our immune system will start producing antibodies to kill the non-reacting bacteria, and these antibodies will be ready for future attack of the invading bacteria. For example, polio vaccines. So we will give the inactivated polio virus in our body. It will start producing antibodies against this polio virus and get stored. Whenever the person will come in contact with the polio virus and the polio virus gets inside our body, the already produced bacteria will kill this polio virus. So this, by increasing the activity of immune system, we are showing the drug effect. So the drugs may act by both enhancing as well as decreasing the immune status. So what we have learned today, so there is a two types. One is drug action, when there is an interaction of drug with some part of our cell, and drug effect, there is some change in physiological and biochemical functioning of the cell, is called as drug effect. In normal, we will call drug effect as both. We combine it, drug action plus drug effect is, we call it as drug effect normal in now today's life. And second, we have seen the list of drug actions like stimulation, depression, replacement, irritation, physical action, chemical action, antibody action, and the last, that is modification of immune system. Thank you.